lecture for the today's topic is regarding mammary gland. So we'll see the location and extent of the mammary gland. This is known as the clavicle over here. This is known as second rib. This is known as the sixth rib. So if you see the vertical, the extension is from second to sixth ribs, and if you see the horizontal extension, so that is from the lateral border of the sternum to the mid axillary line. This is known as the axilla. So if I'll draw a line here, that is known as the mid axillary line, and this nipple will be at the fourth ribs, right? So this is the extension of the mammary gland, that is from second to sixth, from the lateral border of the sternum to the mid axillary line. Now we can see there the mammary gland, it is extending laterally into the axilla also. That is known as axillary tail of the mammary gland, and it is passing through the foramen, that is known as the foramen of Langer. Can you see here, this is known as the axillary tail of the mammary gland, and this foramen is known as the foramen of Langer, which is formed by the axillary fascia. Now the shape of the mammary gland is hemispherical, or we can say pendulous in shape. Can you see here, this is known as the foramen of Langer, and this is known as the axillary tail of the mammary gland. And this foramen of Langer is an opening in the axillary fascia for the axillary tail of mammary gland. If you see the mammary gland, there is a superficial part and deep part. So superficial part consists of skin, nipple and areolar area. In the deeper part, that is stroma, parenchyma or glandular tissue. Then we have the mammary gland proper also. But before dealing with the superficial part and the deep part, let's know about the male breast, right? Which is rudimentary. It is not well developed in the male, right? So it is composed of the duct system without alveoli, and it is supported by fibro-fatty tissue. In abnormal as well as in case as well as there is a bilateral hypertrophy of the male breast, or we can say in some of the male there is enlargement of the mammary gland. That condition is known as gynecomastia, and it is observed in the Klinefelter syndrome, that is 47XXY, and it is also seen in endocrine disorder individual. It is also seen in impaired liver function individual. So note that male breasts are richly drained by the lymphatics, and prognosis of the breast carcinoma of the male is worse than that of female. Now let's know about the superficial part. Superficial part consists of the nipple area. So here we have the nipple area, and it consists of the muscles, that is the circular muscles as well as the longitudinal muscles, but it is conical in shape, or we can say it is cylindrical, and which is present near the fourth intercostal space. And can you see here, there are the lactiferous duct which opens on the nipple, and it consists of circular as well as the longitudinal muscles. So the circular muscles helps in the erection of the nipple, or it helps to erect the nipple. And there is a term known as the longitudinal muscles. This longitudinal muscles helps in retract the nipple, and rich nerve supply with sensory receptor will be present near the nipple area. Can you see here, this is known as the nipple area, and can you see here the lactiferous duct is opening on the nipple area. Now there is a term known as areolar area. So it is circular pigmented area which can be pink or brown color. Pregnancy causes a darkish pigmentation, or the darkish pigmentation increases during time of pregnancy and lactation. There is a presence of sebaceous gland which is deep to the areola, and it is enlarged as tubercle of Montgomery. So we can say that sebaceous gland is enlarged, and that is known as tubercle of Montgomery, and it is enlarged during time of pregnancy. And the sebaceous gland helps in production of the oil, or you can say oily production will be there, that helps in lubrication of the nipple as well as the areolar area. Now deep to the areolar area, there is a lactiferous sinuses. And see here, this is known as the lactiferous sinuses. So this lactiferous sinuses is nothing but a dilatation, right? So lactiferous duct is dilated to form a lactiferous sinuses. And one more important term that is known as the lymphatic plexus of Sapi, that is below the areolar area, and it helps in collection of the lymph from the areolar as well as from the nipple area. So can you see here, this is known as the plexus of Sapi. Now we have the deep part. So deep part contains a gland of fatty tissues, areolar tissue, suspensory ligament of Cooper, right? And let's know something else about the deeper part. Can you see here that there is a term known as retromammary space, or there is a lake which helps to separate the MG, means mammary gland, from the pectoralis major fascia, right? So this is known as the pectoralis major muscles, and there is a fascia that is known as the pectoral fascia, and here there is a space that is known as retromammary space, which consists of the areolar tissue. Now retromammary space, this space helps in mobility of the mammary gland at the breast, and it is also a space for breast implantation. So we can see here. Now we have the deep relations. So can you see here, if this is a mammary gland, the deep relations are, that is known as pectoralis major muscles, that is the in the medial two-third, and below there is a term, there is a muscles known as external oblique muscles. Then there is another muscles that is known as the serratus anterior muscles. So mostly these three muscles, pectoralis major, serratus anterior, and external oblique muscles, this all the muscle is forming the deep relations of the mammary gland. Now let's know about the glandular part. So this glandular part is known as the parenchyma. There is a connective tissues part, stroma, which can include the fibrous tissue as well as the fatty tissue, and there is a term known as suspensory ligament of Cooper. Keep in mind, so this is none of the superficial part, or we can say the skin part, and this is none of deep fascia. And can you see here, this is known as the ligament, which is connecting the skin to the pectoral fascia. So this is known as suspensory ligament of Cooper, and this suspensory ligament of Cooper divides the mammary gland into 15 to 20 lobes. So there is the small 15 to 20 lobes is present here. It means the suspensory ligament of Cooper is dividing mammary gland into 15 to 20 lobes. Now can you see here, in the glandular portion with parenchyma, it consists of 15 to 20 lobes, each with multiple lobules, and it also contains the alveoli, or it consists alveoli or acini. There is a term known as lactiferous duct, right? Can you see here, there is a term known as lactiferous duct, and this is known as the lactiferous sinuses. So this lactiferous duct goes and opens into the nipple area. There is a dilatation of the lactiferous duct, that is known as lactiferous sinus, it's seen here, okay, which also goes and opens into the tip of the nipple area. And keep in mind, lobes radially arranged, hence if you do the incision, or if you give the incision should be given in the radial manner or radially. Glandular tissue increase during time of pregnancy and lactation. So during time of the pregnancy or lactation, this glandular tissue is increased. Now we can add some few points here. Duct consists of myoepithelial cells. There are the smaller ducts and larger duct. Larger duct consists of columnar epithelium, and smaller duct consists of the here the larger duct columnar epithelium. And note that carcinoma of the breast start from the larger duct, and smaller ducts that can be a site of benign fibroadenoma. And let's know about the connective tissue, that is known as stroma. So we have learned about already the suspensory ligament of Cooper. So it consists of fibrous connective tissue, the adipose tissue. This fibrous tissue, it forms the septa, which runs deep surface of the glands to the skin, and that is known as suspensory ligament of Cooper. So the suspensory ligament of the Cooper, it helps to give the actual shape of the mammary gland, and the elasticity of the breast is lost during time of the pregnancy, and which leads to pendulous of the mammary gland. And this suspensory ligament of Cooper is also involved in carcinoma, and which causes the dimpling of the mammary gland. So can you see from this diagram, the concept will be clear. This is known as the pectoral fascia. This is pectoralis major muscles. This is the skin, and something which is connecting the skin to the pectoral fascia, that is known as the suspensory ligament of Cooper. And this suspensory ligament of Cooper is dividing the mammary gland into 15 to 20 lobes, and each lobe consists of the lobules. Can you see here in this diagram, right? So this is one lobe. Inside that lobules will be present here, and there is acini also, and this is known as the lactiferous sinuses, and which goes and opens into the nipple as well as the areolar area. There is a blood supply of the mammary gland. So these all are the arteries supplying the mammary gland. We can see here there is a perforating branch of internal thoracic artery. Okay, that is in second, third, and the fourth intercostal space. So this is supplying to the mammary gland. A branch from the axillary artery, that is superior thoracic artery, is also supplying to the mammary gland. And a branch from the acromiothoracic artery is also supplying to the mammary gland. Right. One of the important artery that is known as lateral thoracic artery is also supplying mammary gland, and a lateral branch of posterior intercostal artery. These all are the arteries which is supplying to the mammary gland. There is a nerve supply also. Anterior and lateral cutaneous branch of 4th to 6th intercostal nerve is supplying to the mammary gland, which also conveys sympathetic fibers to the mammary gland. Same how we have the venous drainage. So the veins can be superficial veins and the deep veins. And one more thing we can add here, that is circulus venosus, which is a part of superficial vein, right? So there is a terminal subareolar plexus of the vein, which we have already studied in the previous slide. So superficial and deep veins drains into the internal mammary veins, into the axillary vein, into the posterior intercostal vein, right? And can you see a posterior intercostal vein which drains into the azygous vein. Can you see here, if this is known as circulus venosus, so it goes and drains into the internal thoracic vein. Finally, this internal thoracic vein goes and drains into the subclavian vein, and which goes and opens into the right brachiocephalic vein and into the superior vena cava and into the right atrium. Same how, can you see here from the circulus venosus, all the blood is drained into the axillary vein, then which continues above as subclavian vein, which goes and drains again into the brachiocephalic vein and into the superior vena cava. Same how, the blood from the mammary gland is drained to the posterior intercostal vein, to the azygous vein, and from the azygous vein into the superior vena cava and again to the right atrium of the heart. Now from the azygous vein, the blood can pass to the internal vertebral venous plexus of Boston, and from here it can easily communicate to the brain. So can you see here the communication through the posterior intercostal vein into the azygous vein into the internal vertebral plexus of the Boston, which in turn communicates with the transverse and sagittal sinus to the brain, and the malignancy can spread to the brain, to the abdominal area also, to the other organs, to the brain, vertebra, ribs and skull. It means entire body the malignancy can spread. Same thing which I have explained over here is mentioned in this diagram also, right? So this is known as the brachiocephalic vein, this is known as the right subclavian vein, this is an internal jugular vein, and can you see here this is known as the azygous vein, which goes and drains into the superior vena cava. Now we have the lymphatic drainage. So what we have to know is, so drains, the lymphatic drainage. So lymph is drained into the following group of lymph nodes. So we have to know the lymph nodes. So we have the axillary lymph nodes, and again axillary lymph nodes is divided into 5 subgroups. We will know the name. Then there is a internal mammary lymph nodes, supraclavicular lymph nodes, and posterior intercostal lymph nodes. Can you see this is known as the mammary gland. So here the lymph nodes, that is known as internal mammary lymph nodes. This is known as the clavicle. So above the clavicle there is a supraclavicular lymph nodes, and below the clavicle, if you see here, the apical lymph nodes, and this is known as the posterior intercostal lymph nodes. But in the axillary, we have 5 group of lymph nodes. So can you say here apical, central, the lateral group, anterior group, and posterior group. So this all 5 group of lymph nodes is under the axillary group, right? So keep in mind, we have a superficial group of lymphatics and deep group of lymphatics. Superficial group of lymphatics drain the skin over the breast except nipple and areolar area. So it is not draining the nipple and areolar area. There is a deep group. So deep group is draining the parenchyma of the breast, nipple and areolar area. We can see from this diagram, right? So let's divide the mammary gland into 4 quadrant. Can you say this is known as the upper lateral? This is known as the lower lateral, this one, right? So this is upper medial and this is the lower medial. So the upper lateral and the lower lateral, right? So upper lateral and lower lateral. So this group of lymph nodes, if you see here, right, or this quadrant, upper lateral and lower lateral, it goes and drains into the axillary lymph nodes, right? That is the anterior, central, and finally to the apical group of lymph nodes. Then we have the upper medial. So this is upper medial. From the upper medial, if you see here, it goes and drains into the parasternal lymph nodes, and from here it also goes and drains into the supraclavicular lymph nodes, right? Then we have the lower medial. So this is lower medial. From here, the lymph is drained to the parasternal, or this is known as, imagine that here the diaphragm is there. So below the diaphragm we have subdiaphragmatic lymph nodes, right? And through the anterior-abdominal wall to the hepatic group of lymph nodes, that is through the falciform ligament, right? And through these nodes the malignancy may spread to the other side also. So from the lower medial part of the mammary gland to the below the diaphragm, and from the diaphragm it comes to the ovary also, that is known as the Krukenberg tumor also. We'll see later this one. So that was about the superficial group. We have the deep group also. So deep group, there is a parenchyma, nipple and areolar area, right? So the parenchyma, here it goes and drains into the anterior axillary lymph nodes through the axillary tail of the mammary gland. And nipple and areolar area, we have the term known as subareolar plexus of Sappi, and from here the lymph is drained into the anterior axillary lymph nodes, and from the medial part of the gland to the parasternal, posterior interposterior lymph nodes, supraclavicular lymph nodes also. There is a deep part of the glands also. So there is solitary lymph channel which pierces the clavipectoral fascia to the pectoralis major muscles also, right? And to the anterior axillary lymph nodes, that is the backdoor exit, right? And sublymph from the deep part reach to the nodes, that is we have between the pectoralis major and pectoralis minor, called as rotor's node, right? So this is pectoralis major, this is pectoralis minor. So it also goes and drains into the rotor's node. Now if you see the overall about the lymphatic drainage, superficial part, that is excluding nipple and areolar area, right? So upper lateral and lower lateral goes and drains into the axillary group of lymph nodes, upper medial into the parasternal and supraclavicular lymph nodes, lower medial into the parasternal lymph nodes and hepatic group of lymph nodes. So deep part including nipple and areolar area, 75% of the parenchyma drains into the axillary lymph nodes, 25% of parenchyma into the internal mammary lymph nodes, 5% of parenchyma into the posterior intercostal lymph nodes along the posterior intercostal vein. Can you see here? Along the posterior intercostal vein to the posterior intercostal lymph nodes. Now there is the clinical aspect about the mammary gland. So we have to do the investigation of the mammary gland. So that investigation is done with the help of the term known as mammography, that is the X-ray of the mammary gland. So soft tissue radiograph of the breast will be there. So there can be a regular self-examination of the breast, right, help in early detection of the breast cancer and which leads to an effective treatment. So with the help of the mammography, we can see what is the problem. That is the investigation part. So that is a term known as FNAC, fine needle aspiration cytology. So small part of the cell is taken from the mammary gland and it is used for the cell diagnosis, whether it is benign or malignant type of the cells will be there. So we have to check it. So same how axillary tail. Sometimes it is well developed axillary tail mistaken for the enlarged lymph nodes or lipoma. There can be cracking of the lymph nodes. So in the later pregnancy and the lactation, so nipple should be washed and lubricated with the help of lanolin, otherwise the cracking of the nipples takes place. You can see here there can be the infection and or we can say inflammation of the mammary gland takes place, okay, with abscesses. There can be a cyst in the mammary gland. Tumor will be there. So tumor can be benign or malignant. So benign means lipoma or fibroadenoma. Again, malignant means again the carcinoma will be there. So spread by the local as well as the lymphatic and the bloodstream, right? So there can be a hard lump with retracted nipples. One of the important clinical condition, that is the POD orange, that is the orange like skin appears, right? So which there is involvement of the skin of the breast due to the cutaneous lymphatic edema. So edema will be there. And in the advanced scenario, there is ulceration, fixation of the chest wall, metastasis to the viscera as well as to the bones also. So treatment, we have the mastectomy, radiotherapy, hormone therapy, chemotherapy will be there. You can see here the breast cancer mostly arises from the epithelial cells of the lactiferous duct. So let's see in the diagrammatic representation. This A is known as the skin dimpling, right? And you can see here this is known as the ligaments of the Cooper, and here the dimpling of the skin takes place. So cancer is over here, and can you see here this is the nipple area, and just behind the nipple there is a retraction of the nipple on the posterior aspect, right? So and in the third image you can see here that is the POD orange conditions. In the skin looks like a orange like structure. So can you see here A number means due to pulling of the ligaments of the Cooper, B due to retraction of the lactiferous duct, and C is due to the obstruction, that is lymphatic obstruction will be there. So in the POD orange condition there is the lymphatic obstruction and which leads to edema also, right? There is an important term that is known as Kurkenbach tumor. So basically what happens here, lymph from the inframedial part, so this from this part communicates through the rectus sheath, right? So here the rectus abdominis muscles will be there and it will communicate through the rectus sheath and it will pierce the linea alba and it forms the subperitoneal plexuses, and finally from here it drains into the subdiaphragmatic, that is below the diaphragm, right? Subdiaphragmatic lymphatic nodes, and from here it will pass through the falciform ligament and reach to the hepatic group of lymph nodes. It can also cause the obstructive jaundice also, and the tumor cells from here it will drop from the subperitoneal plexus right into the general cavity of the abdomen and it will reach to the ovary, right? And this tumor it will enters through the ostia, and what happens by ovulating the Graphene follicles, and here can be a tumor that is known as the Kurkenbach tumor, which is known as the secondary deposit on the surface of the ovary. So this is known as the Kurkenbach tumor. So this is one of the important clinical aspect of the mammary gland. So other congenital anomalies we can see the polythelia will be there, that is supernumerary nipples over the breast. Thelia is there, that is known as the no nipple over the breast, mainly the accessory breast. The polymestia, accessory breast along the milk ridge. Amestia, no breast development, and the amagia, that is nipple developed but no breast development, and in some case there is a term known as gynecomastia. Thank you.